Not all metabolism happens in the mitochondria. In fact, some of the most essential reactions, like glycolysis and the pentose phosphate pathway, happen right in the cytosol. One of the star players here is glucose 6-phosphate dehydrogenase, which kicks off the PPP, pentose phosphate pathway, and helps to produce NADPH for reductive biosynthesis and antioxidant defense. So whenever you spin down all the organelles and you're left with just the cytosol, well, that's where the transketolase and the G6PD are going to be still clocked in and working hard. Here's a question to explain this. A team isolating metabolic enzymes for liver tissue using sequential centrifugation. So put the liver tissue in and put it in a centrifuge, and then you kind of spin it around. And after the removal of all the membrane-bound organelles, only cytosolic components remain. So now we only have what's in the cytosol, which enzyme activities are still detectable. Well, it's going to be the ones that do not occur in the mitochondria, so it's going to be your glucose 6-phosphate dehydrogenase. Why? Because that's a key player in oxidative phase of the PPP, which produces your NADPH. So our correct answer is A. Why is it not B? Well, that's involved in the urea cycle. It's a mitochondrial enzyme. Why not C? That's involved in the TCA cycle. That's in the mitochondria. Why not ACT in the mitochondrial matrix? Why not acyl-CoA dehydrogenase? That's involved in beta oxidation, and that's also mitochondrial. And then citrate synthase, that's another TCA enzyme that's located in the mitochondria. If you found this helpful, like and subscribe for another question a day.